Hi, my name is Madison Chapman. I'm an Education Outreach Liaison at Doylestown Health, and with me today is Bridget McEnroe. She is the Director of Infection Prevention and Sterile Processing at Doylestown Health. She has received her bachelor's in nursing from Drexel University and has a certification in infection prevention and control. Recently, she was honored as a leader in healthcare by the Philadelphia Business Journal. So thank you so much for being here today. If you could just tell me a little bit about what you do at the hospital.
Sure. Thank you, Madison. And thank you for having me here today to talk about such an important topic. A little bit of background about me is I have been a nurse for 39 plus years, with the majority of my nursing career spent between the operating room and in infection control. Around 4 years ago, a little over 4 years ago actually, I joined the Doylestown Health family, and it has truly been a positive decision for my career and a positive decision for me as the amount of support that I get throughout the organization, especially during this pandemic, this time of uncertainty. So a little bit about infection prevention. Infection prevention has truly come to the spotlight over the last year with the COVID pandemic. Infection prevention are healthcare providers who assist with preventing or stopping the spread of hospital-acquired infections and or infectious or communicable diseases among people in the healthcare setting, communities, and in the patient population. And how do we do this? We do this by providing education on how to prevent such infections from spreading. So for example, I think a really good example is we work very closely with the Department of Health when we start or we've identified any sort of reportable or communicable infectious disease. And what does that mean? So for example, let's use something like salmonella. So we are one hospital in the Bucks County area. If we start seeing a case or two of salmonella, first of all cases of salmonella are reported to the state. And then the state looks at which county that these infections fall in, and they send that information to the counties. So if we're reporting 2 infections of salmonella, and the other 5 hospitals in their counties are reporting infections of salmonella, this could equate to there was an outbreak, whether there was an event that happened or whether there's an eating establishment that is contributing to the salmonella. So this is how closely the Department of Health does work with the hospitals, and the hospitals we work with the Department of Health to keep the community of Bucks County safe.
So you definitely stay pretty busy at the hospital. So today we are actually going to be talking about the differences between COVID, flu, the cold, and allergies. But first, I'd like you to give a little bit of a background on what we're seeing in our community with COVID, cold, and the flu.
So in the month of June and July, we began seeing a decrease in COVID infections to the amount that for both months we reported below 1,000 cases each month. In the month of June, I think there was a little over 200 cases reported in the Bucks County area, a little bit more in July. But then as we started transitioning to August and September, we really started to see an increase in cases, averaging about 3,000 cases each month, and September's not yet over. So what happened? In July, it was identified that that strain, the Delta strain that most people heard back in, I think it was January, that was occurring in India, had made its way over to the States and then has made its way up into this area. So the Delta strain is a form of COVID-19, but it's much more contagious and it's easily transmittable. So with that, we started to see an increase in cases. And interesting, we also started to see an increase in our pediatric population. Was that to be expected? Well, yes, as activities are starting to open again for schools, and as school is starting to open, we did expect to see some sort of increase, especially that currently the vaccine has only been approved for those from 12 and older. So we did see a couple cases in our younger population, the population of about 4 to 8. We also, in the month of August, started to see cases evolve in that 9 to 11-year-old. So it was those age groups where we were seeing some cases sporadically appear. And then once schools did start opening and events started getting back to normal, we did start seeing an increase in cases of COVID in the high school, middle school and high school population, as not every child is vaccinated. I will share with you that just within the own testing site of Doylestown Health, the pediatric population out of all our positive cases is accounting for about 20% of them. So it's quite high.
Wow, okay, so we are getting into the fall season, allergy season, flu season. There can be that blurred line of, is the symptom COVID? Is it the flu? Is it the cold or my allergies? Am I overreacting to these symptoms? Should I even get tested or go to the doctor? All of these thoughts can make everyone really anxious, and that was probably something that we didn't even see before the pandemic. So what are the similarities and differences in symptoms between all of these?
Yeah, that is very, 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 very important to be able to know the symptoms and to be able to identify what symptoms you are having. But before I get into the symptoms, I think it's even more important to remind everyone that the respiratory viruses cause COVID, flu, and the cold, common cold. They're different viruses, but they are all respiratory viruses, so you are going to have respiratory symptoms with each one of these. Allergies, there are different allergies, but if you have allergies to pollen, mold, specifically this time of year, you're also going to have some respiratory symptoms. So how are you going to decide what do you have and what do you need to do? So let's talk about some things that are common. So fever. Fever is very common in COVID and flu, but it's not going to be so common in colds and allergies. Can you get a fever with a cold? Yes, you can. But it's not going to be as common as some of the other symptoms you're going to get. Some more things that are common are going to be fatigue. Across the board, that if you have any allergies, cold, flu, COVID, you're going to feel some sort of fatigue, maybe not to the strength as another one, and we'll talk about that. But yes, expect that. Sore throat. Sore throat's going to be more common with your respiratory illnesses caused by viruses than it is with allergies. Runny nose, stuffy nose, sneezing. Believe it or not, these three are extremely rare with COVID. So runny nose, stuffy nose, sneezing are going to be very common in your cold, in your allergies, and you can sometimes get them in the flu. Shortness of breath is more so in COVID when you reach a serious infection, when your infection goes from being COVID into a COVID pneumonia. And allergies. You're not going to have as much shortness of breath with flu or a cold. I think the best way to explain the first three, the COVID, the flu, and the cold, is that COVID and flu are going to give you the most similar type of symptoms. For example, both COVID and flu are going to give you a fever. Fever is going to be higher in the flu than it is in COVID. And COVID symptoms are going to start gradually. And what do I mean by that? You may wake up similar to a cold. You may wake up just kind of feeling off, maybe having a little bit of tiredness. You might have a cough, just a little bit of aches and pains, headache, but you're not getting that severe symptoms right away. With the flu, you could be fine in the morning, start feeling off by afternoon, and be in bed and down for the duration of your illness with influenza. Influenza usually is accompanied by a high fever as high as 103. Your headache is extremely intense, and that headache also goes along with body aches. Your whole body hurts. It's not just your head, it's every part of your body. You can be tired and have a sore throat. They're very common. And you also, sometimes you will get that runny nose, stuffy nose, and sneezing. But the cough's going to be more common in the flu than it is in a cold or allergies. Shortness of breath is rare. Usually from the time you're exposed to you get symptoms are between 1 and 3 days, and your symptoms are going to last about 5 to 7 days, up to 10 days. With COVID, you get up and you don't feel good. You start feeling off. You may have a low-grade fever, your throat's starting to get scratchy, the day goes on, you develop a cough, you wake up the next day, you're just feeling out of sorts, your throat hurts a little more, you're starting to notice that you're losing your sense of taste and smell. Day 3 comes along, you're getting sicker, your headache starts intensifying, all your symptoms start intensifying a little bit. This is more of what you're going to see with COVID. Exposure to symptoms is going to occur 2 to 14 days versus the 1 to 3 in flu and cold, and they're going to last longer. They're going to last somewhere between 10 to 20 days, whereas the flu usually subsides around day 7 and the cold subsides around day 3 to 7. Allergies, as long as it's allergy season, you're good, and as long as you have an exposure, you will develop those symptoms and have them. So what are some ways to try to decipher? If you have allergies and you know you have allergies, take your allergy medicine. If your symptoms go away, they're your allergies. Remember, COVID and flu, you're going to have a fever, but the fever is going to come on quick. Your symptoms are going to come on quick, and your fever is going to be higher. And also know yourself, know what you're doing. So if you are at an event or in a public place, an indoor public place, and you find out that someone there that you were in contact with has COVID, chances are if you start developing a low-grade fever, a headache, a sore, scratchy throat, a cough, a severe cough, you possibly could have COVID. If you know you've been exposed to the flu, and you start literally, I had the flu once, so I can share this. I went to work in the morning, and by the time I got home, I was flat in bed for the next 3 days, and literally everything was intensified from the aches and the pains and the headache and the fever, and you could feel your fever going up and down because that also contributed to your aches and pains. A little bit of a runny nose, a cough. You have it. And a cold, I think we all know colds, try over-the-counter medicine. Very rarely do you have a fever and a headache with your cold. If you do have a headache, it's probably going to be related to the fact that you might be having some congestion in your sinuses. You're not going to lose your loss of taste and smell unless you are both with allergies and cold. Can you lose your taste? Of course you can, because you're so stuffed you can't taste anything. Remember that COVID, you lose your taste and smell without being stuffy. More with the cold and allergies, you're losing it because you're feeling that stuffiness. So know yourself, know what you've been exposed to, and know your symptoms.
Yeah, and I want to highlight, you talked about a headache a lot. As a symptom for all of these, and when should I be concerned about that headache?
So the headache is going to coincide with other symptoms. As I shared, so the COVID headache is more popular and started surfacing with the Delta strain. And that's when the sore throat started to surface. But prior to that, we were not seeing a lot of headaches and sore throats. So talking to people that have had COVID, the Delta strain of COVID, which is the more recent cases, they share that their headache starts slow and then intensifies to about a migraine-type headache. Whereas the flu, it does not start as a slow, dull headache. It goes straight to that intensity of a headache. In a cold, the headache's sort of rare. If you do, like cold and allergies, if you do start experiencing a headache, it's usually going to be around your sinus area, which is below or above your eyes.
And to wrap up symptoms, when should I see the doctor?
All right, once again, know yourself. So I think everybody needs to understand as we try, if you feel you have the COVID or the flu, the best thing to do is call your doctor. Do not go in. We do not want to expose. Both COVID and flu are highly transmissible. COVID is more transmissible, but they are both highly contagious. So call your doctor if your fever you start developing the high fever and you know you have an exposure, your doctor will guide you on some over-the-counter treatment and medications that you could take to help with both, with the flu and with COVID. With the flu, as soon as you start getting that high fever, intense headache, body aches and pains, it's really important to call the doctor, not so much to be seen, but they can start you on medication to lessen the time you have the symptoms. That's Tamiflu is one of the most popular ones. So it's important to call your doctor so that he understands what's happening with you. It might not necessarily mean that he will have you come in, but for both the COVID and flu, he may have you go get tested to confirm which one it is.
Well, thank you for covering all of those symptoms. I know it can be super overwhelming and confusing, and I think you did a great job explaining all of those.
Thank you.
And now we are going to talk about vaccines. They're the best way to protect yourself from these viruses and diseases, but it doesn't give you that complete 100% immunity from catching an infection. So when it comes to COVID, is it too late to get the COVID vaccine?
Absolutely not. Now is more than important time than ever. If you have not been vaccinated for COVID-19 with one of the approved vaccines, I highly recommend you seriously think about getting it, receiving it. The reason is because we are moving into flu season and cold season. Not that the COVID vaccine is going to protect you from the flu or colds, but it will help you determine truly if you have an exposure to multiple respiratory viruses. It's going to help with your symptoms. So, for example, what we've recently been seeing is, have there been breakthrough cases? Of course there have. If you remember from the beginning, both Pfizer and Moderna have always stated that they were about 95% effective from keeping people out of the hospital. And that was the goal. Our goal with these vaccines was to, if you developed COVID, to keep your symptoms mild enough, first of all, prevent you from getting it. But if you would get COVID, that we would be able to keep you out of the hospital, keep you home, have your symptoms be extremely mild, and resolve within a matter of days versus weeks. So the one important thing, though, is to remember, if you are now choosing to get the vaccine, which vaccine you get is going to determine when you're going to be protected. So, for example, Pfizer requires 2 vaccines 3 weeks apart, and then 2 additional weeks till you develop immunity. Moderna requires the 2 vaccines 4 weeks apart with an additional 2 weeks, and J&J requires that 1 vaccine with 2 weeks before you have your immunity. So any vaccine you choose is the right vaccine for you, but just please remember it could take anywhere from 3 to 6 weeks until you develop the immunity. That's expected.
So if I get COVID while having the COVID vaccine, what do my symptoms look like, and is it necessary to go ahead and get tested?
So what we've been experiencing, the majority of breakthrough cases that we have seen have been so mild, cold-like symptoms, that a lot of the patients were not even intentionally going to get tested. They thought they had a cold. What drove them to be tested was the fact that they had an exposure, whether the exposure was with a family member or whether they attended an event that they then learned that they had an exposure to someone there who went on to develop COVID. Symptoms are, cold, like I said, cold-like symptoms, resolve quite quickly. Do you need to be tested? If you would like to know that you have COVID, 100% call your doctor to get tested. If you know that you have been exposed and now you're developing these symptoms, chances are that you do have COVID. So that's going to be the personal choice whether you want to get tested. I think it's always good to get tested because once you do confirm that you have COVID, you still need to make sure that you protect other people. By protecting other people is you need to stay home. So if you are vaccinated and you develop COVID-like symptoms and you're diagnosed with COVID, you will need to stay home and stay away from people for 10 days from the date of your first symptom, similar to those people not vaccinated. If you're asymptomatic and you know you have an exposure, do you need to get tested? At this point, what the CDC recommends is watch yourself for symptoms. Do the 14-day where you try to stay away from people as best you can. You may go to work. Most jobs still are requiring that people do wear a mask. Your mask is going to provide that protection for your other workers and your peers. When you're with your family, maintain that 6 feet at all times whenever you can. That way, if you do develop symptoms, you're not going to expose anybody else.
And of course, the booster is now in the news,
Yes.
so should I get it and why?
So the booster. The booster has come out. So I think what everybody needs to remember is even though we're 20 months into this, we are still new. COVID's new. The vaccines have not even been out for a year yet. We do know that we still maintain immunity even though we're 6 to 8 months out. But we also have seen some breakthrough cases. And the breakthrough cases where people are requiring hospitalization for a few days for some sort of treatment are those patients that are elderly or immunocompromised. Both of these populations, the elderly and the immunocompromised, have a weakened immune system. And since the vaccines do count on the immune system to build up the immunity, whether it's just their natural immunity isn't as good, cannot work to build it up as you get older, or if you're in any sort of treatment, whether you're getting chemotherapy or you're taking medications for your immunocompromised state, that can interfere with the vaccine building up the same immunity that other people are getting and maintaining. So that's why Pfizer has recommended that anybody that is immunocompromised or elderly begin to get the vaccine first, then transitioning to healthcare workers that have exposures. And eventually, as we do start seeing the reproduction or the production of additional vaccines, it will be open to anyone 6 months on after they receive their first dose.
And now that we're starting flu season, will the flu shot affect my COVID vaccine at all?
No, it will not. So just please remember, both vaccines are perfectly safe. Both vaccines neither of them have live virus in them. CDC recommends not only that you can get both vaccines, but you could get COVID and flu at the same time. The only thing they recommend is you get them in different sites. So one in one arm, one in the other arm. But yes, you can get both. They're both safe to get together.
All right. So as we're wrapping up this important conversation, what points would you like people to take home from this?
I think the most important thing to remember is that everything we talked about, the COVID, flu, cold, they're all respiratory viruses, so the symptoms are going to be similar. You need to know yourself, know your vaccine status, know if you've been exposed, and remember, the flu is going to come on quick and it's going to come on intense, and usually you will recover in about 5 to 7 days. COVID is going to come on a little bit more slower. So you might start with feeling a little bit of a scratchy throat, a cough, a fever, a headache, but they're going to be mild. It's going to be as the days progress instead of hours that you're going to start feeling more intense symptoms. Rarely in COVID are you going to have a runny, stuffy, or nose or sneezing, but they're going to be quite common in both the flu and cold and in allergies. And allergies, as long as it's allergy season, if you're known to have allergies, you're going to continue to have them. So take your allergy medicine. If your symptoms reside, it's allergies.
Well, thank you so much, Bridget, for joining me today. I really appreciate it.
Thank you for having me.